Hi guys, welcome back to Code Master Coach, your medical coding tutor. Okay guys, these coach diaries, this one could be a little controversial. My question is, are we taking the physician out of healthcare? The more I'm getting into my coding and my billing and my work with healthcare, I've learned that in the hospital, you have a coding section. They're probably sending them home now more than anything else, but you have your billing section. So coding and billing are typically separate in a hospital setting. But in a physician's office, that receptionist, office manager, coder, biller can be one person doing it all. Been there, done that? Been hired as the medical coder to get there and find out that the receptionist has left as well and ask if I would fill in at that desk and filled in at that desk and end up doing the reception, responsible for coding, and then responsible for submitting the claims for billing. But it gave me the opportunity that I didn't have in the hospital. I get to see the remittance advices when they come back from the insurance company, letting me see that although we billed one price, how much the third party payer actually reimbursed. When I was coming up, and I'm older, guys, I'm up there almost 60 years old, we were always made to feel like, oh, you haven't succeeded unless you've gone to school to be a doctor or a lawyer, because those are supposed to be the high paying jobs. But when I look at some of these remittance advices that I receive back from the third party administrators, the insurance companies, it makes me wonder how physicians can make money. I know sometimes it does get ridiculous. In the way that I teach my students in my medical billing and coding class, I say, it's kind of like a hairdresser. And I like to compare, I try to find real world situations. Hairdressers set their prices for the services that they perform. Either you pay it or you don't, get services. But what's different with physicians is that there's a third party administrator involved. There's an insurance company involved. And when we have insurance companies setting fee scales or fee schedules telling you what they'll pay for services, and it's what they determine, that's the insurance company determines, and not what the physician is requesting, who's in control? And when you receive a remittance advice back from a third party payer for a chiropractor who was working with the patient that say had back pain, so the chiropractor decided to do an ultrasound on the back. And then you receive a remittance advice back from the insurance company that says, we're not paying for that ultrasound because the ultrasound was not required to diagnose the patient. You should have just asked the patient to bend over. Are we taking the physician out of healthcare? I question that as I present the information to students in class because, again, I do agree that there had to be some type of control put on healthcare because think about it. If physicians know they've got this skill or this particular skill that God has given them, let me make that clear, to be able to heal or to prescribe or to diagnose or to treat disease processes, the prices could get out of hand. I could see them saying, well, let me see how much I want to charge. And so I understand why third party administrators had to step in and set a price, a fee schedule, or a range and say, look, we got to bring some of these prices in because it can get out of hand. But at the same time, how much control are we really giving up? So I ask again, are we taking the physician out of healthcare? Ponder on that. I'd like to see your comments.